Hey everyone, and welcome to This Explainer. Today, we're going to unpack something absolutely crucial: how massive health insurance entities are actually evaluated on their long-term sustainability and risk. Let's be honest, we usually just think of health insurance in terms of those agonizing monthly premiums or, frustrating copays. We definitely don't associate it with famously dry topics like accounting standards. But behind the scenes, these organizations are dealing with a really complex web of intense, real-world risks. We're talking about everything from massive data security threats to severe climate impacts and shifting health outcomes. To make sense of it all, we're going to use the official SASB framework. That's the Sustainability Accounting Standards Board. So get ready, because we are breaking down the exact metrics that investors and regulators use to measure what actually matters in modern healthcare.
Okay, let's dive right into this. We're going to use these 5 pillars of modern healthcare sustainability as our roadmap today. We'll cover Section 1, what is managed care? Section 2, protecting personal health data. Section 3, access and plan performance. Section 4, improving enrollee health outcomes. And finally, Section 5, climate change and healthcare.
So, Section 1. What exactly is managed care?
Before we can even begin to measure the sustainability of an industry, we really need to understand its immense scope. When we talk about managed care, we're talking about highly intricate logistical healthcare hubs serving a massive, diverse population. Let's break down exactly what these entities do because, well, they offer a whole lot more than just standard insurance cards. Right out of the gate, they offer health insurance products for commercial, individual, Medicare, and Medicaid members. That covers everyone from someone buying on an exchange to employer-sponsored plans to seniors and low-income individuals. And managing each of these distinct demographics carries completely different operational risks and regulations. But they don't stop there. They also provide vital network access for self-funded plans, which is basically when a massive corporation takes on its own financial risk but rents the insurance entity's network of doctors. And they manage incredibly complex pharmacy benefits. It's a deeply interconnected business model. The key takeaway here? Enrollment across these plans is usually tied directly to employment rates, while the entity's revenue is constantly being pressured by medical cost inflation. It's a real balancing act.
Now, what's really interesting about this slide is the sheer density of the official SASB accounting standard table for the industry. Kind of looks intimidating, right? It's literally packed with codes, categories, and quantitative metrics. But hey, don't worry, you absolutely do not need an accounting degree to grasp it. For the rest of this explainer, we're going to demystify this exact table and translate all those dense columns into understandable real-world metrics that actually affect you. Moving on to Section 2, protecting personal health data. Which brings us to our first major risk pillar. Managed care entities hold our most sensitive private information, making them prime targets for intense cyber attacks. The SASB standard requires these entities to look at data through what's called the information lifecycle. It's a 6-step journey: collection, use, retention, processing, disclosure, and destruction. And at every single one of these exact stages, information handling practices directly impact your personal privacy. It's not just about, stopping hackers from the outside. It's about whether they're collecting your data with consent, how long they're securely retaining it, and crucially, how they properly destroy those electronic and paper records when they just aren't legally needed anymore. Now, to protect that life cycle, entities have to prove compliance by implementing 3 very specific layers of system security safeguards. First up are administrative safeguards. These are the formal, documented policies that manage how staff actually conduct themselves and execute security on a daily basis. Next, we have physical safeguards, which literally means protecting the physical computer servers and buildings from natural hazards and, actual physical intrusion. And finally, technical safeguards. These are the digital processes put in place to authenticate users, control individual access, and use heavy encryption. Without all 3 of these working perfectly together, data breaches are pretty much inevitable. But what happens when those breaches do inevitably happen? How do we measure the fallout? It's not just a matter of if a breach occurs, but exactly how much it will cost when it does. The SASB framework doesn't just ask for a nice list of policies. No, it demands hard numbers on the fallout. Entities have to report the total number of data breaches, and they must specifically separate breaches involving standard personal data from those involving highly sensitive personal health data. Beyond that, they literally have to quantify the financial hit, reporting the total monetary losses from legal proceedings, whether that's from civil settlements, regulatory penalties, or criminal actions. It is all about accountability in dollars and cents. Section 3, access and plan performance.
We're shifting our focus a bit now from how well these entities protect our data to how well their plans actually perform for the people paying for them. Honestly, if you remember only one financial metric from this explainer, make it this one, the medical loss ratio, or MLR. This formula breaks down all that industry jargon super simply. You take the incurred medical claims, so the money actually paid out to doctors and hospitals, and you add the money spent on quality of care efforts, like patient safety and preventive care. Then, you divide that total by the health insurance premium revenue. This shows exactly what percentage of total premiums is actually being spent directly on your medical care and health improvements versus administrative costs and profits. It is without a doubt the most important percentage in health insurance.
Another really key aspect of plan performance is access. Regulations force managed care entities to ensure applicants have access to coverage regardless of their health history, gender, or pre-existing conditions. So the standard requires entities to disclose exactly how they integrate considerations of pre-existing conditions and general health status into their plan pricing and rate increases. This is basically how the industry attempts to balance overall affordability with making sure coverage is inclusive for everyone.
But what happens if the care you're paying for is outright denied? Well, investors look really closely at 3 specific metrics to gauge real-world plan performance. First is the enrollee retention rate by plan type. Basically, are people staying or are they fleeing the plan? Then we have the grievance rate, which tracks formal complaints. But the most revealing metric, that's reversed claim denials. We've all dreaded getting that claim denied letter, right? Well, investors actually track how often those denials are actively appealed by customers and successfully reversed because the initial denial was deemed invalid. A high rate here could signal some serious systemic issues in how a plan authorizes care in the first place.
All right, let's look at Section 4, Improving Enrollee Health Outcomes.
Let's move to see how all this builds into the proactive side of managed care. Because at the end of the day, keeping people healthy is not just good ethics, it fundamentally boosts market share and profit margins. A solid reputation for high-quality care relies heavily on prevention. Consider the 2 strategies we are contrasting here. We have primary prevention, which focuses on promoting healthy behaviors right out of the gate. We're talking immunizations, exercise, maintaining a healthy BMI, and smoking cessation. Then there is secondary prevention, which promotes early-stage disease detection and management before conditions become chronic and, frankly, incredibly costly. Entities are expected to disclose their initiatives across both of these crucial strategies to prove they're delivering high-quality outcomes.
But are these prevention strategies just empty corporate buzzwords? Well, the standard tracks actual participation to find out. Look at the specific wellness program categories being tracked here: diet and nutrition, exercise, stress management, mental health, and smoking or alcohol cessation. Entities must calculate and disclose exactly what percentage of their unique enrollees actively participate in each of these programs. It's a very direct metric of how effectively a managed care plan is engaging its members in their own health.
Which brings us to a question that might seem, well, completely out of left field. What does global climate change have to do with your health insurance?
Section 5. Climate Change and Healthcare.
The connection between climate and healthcare is actually profound. Extreme weather events present material financial risks to the entire system, and this brilliantly illustrates why. The SASB standard requires entities to analyze climate-driven health risks, specifically focusing on shifts in geographical incidence, morbidity, and mortality. Just look at these alarming shifts outlined in the standard. We're seeing measurable increases in severe allergic responses, asthma, and heat-induced illness. We are tracking the actual migration of vector-borne tropical diseases like malaria and dengue fever moving straight into traditionally non-tropical regions. Natural disasters are causing surges in waterborne diseases like cholera. And decreased food availability is leading to rising rates of human developmental issues like malnutrition. These aren't just environmental issues anymore. They are imminent healthcare crises.
So the crucial point is this: managed care entities simply can't ignore the environment. They must explicitly incorporate these climate-driven health risks into their financial risk models and risk adjustment activities. They literally have to project exactly how extreme weather and shifting disease patterns will impact their future revenue, their operating costs, and ultimately the overall affordability of the plans they offer you. Climate risk is quite literally healthcare risk.
As this quote from the SASB standard highlights, a focus on patient outcomes and plan performance is what ultimately shapes this industry's future. Modern managed care is rapidly evolving. It's no longer just some financial mechanism for paying hospital bills. To be sustainable for the long haul, these entities must actively sustain human health through better outcomes, fiercely protect our sensitive data, and adapt to the severe environmental realities of our changing planet. All of these threads are just deeply, deeply interconnected.
Which leaves us with this final provocative thought. We've seen the metrics, right? And we've seen the very real risks.
But are our healthcare entities adapting fast enough to climate change and sophisticated cyber threats to truly protect both our health and our wallets? It's a massive question, and it's one the industry will be answering in real time over the coming years. Thanks so much for joining me for this explainer, and for dedicating your time to understanding the systems that sustain us. Keep learning and stay curious.